Hi, Comi family. So this is another talk show with Sanar Hospital that's located at Golf Course Road, and we have tied up with them to spread awareness about the different problems that we all are facing. Last time we did awareness on liver healthy liver, and this time we have taken an initiative with Sana about maintaining a healthy heart, and soon we'll be joining with the doctors, cardiosurgeon, and as well as the cardio specialist who will be guiding that why the youngsters have been facing this problem so frequently, and we are all are worried and we want to know the reasons. So let's welcome to the show the doctors from Sanar Hospital. Welcome to the show, Dr. Akhil and Dr. Jhamb. And it's really privilege for us that you're there at a Comi Talk show. So we'd like to hear from you that about your experience and where you're working.
I'm Dr. Jhamb. I'm cardiologist. I've done my DM in cardiology 30 years ago from All India Institute of Medical Sciences, Delhi. And since then, I've worked in various hospitals in Delhi, Gurgaon, and founded the departments of cardiology in a couple of hospitals here. Presently, I'm at Sanar Hospital on Golf Course Road, recently founded, where we treat a lot of domestic but a good number of international patients from various countries. And we are doing good clinical as well as non invasive cardiology and interventional cardiology work, where we do angiographies, angioplasties, and various valvular procedures, implants, pacemakers, devices, radiofrequency ablations.
He is called the Beach Pitama in cardiology, So I'm really proud that sir, we are, having you live, That's really nice. Yes, sir.
I am Dr. Akhil Govel. I am working as the head of the department and director, Department of Cardiac Surgery at Sanar International Hospital. I had my specialty training 20 years back from AIMS Delhi, and presently we are doing all types of cardiac and vascular surgeries at Sanar International Hospital.
Thank you, sir, for coming to the Comi Talk show. So my first question will be that we know that heart attacks have always been there from centuries. But why we are hearing more often now these days, and especially in the younger generation? So what is the reason, sir?
It's very important to understand that there may be reasons beyond diet and exercise. So, here, while we're sitting in the gym and we see people exercising all around us, we find individuals very conscious of what they eat and what exercise they do, what is their physical activity. But we must remember that for prevention of heart disease, there are various risk factors beyond these two. For example, smoking, high blood pressure, high sugar, altered lipids. A lot of Indians have raised triglycerides and familial dyslipidemias. All of these make up for other risk factors which we do not know of, any of us sitting over here. I would not, just by looking at anybody's face, know whether he's been a smoker or if he has high blood pressure or his sugar or cholesterol values are normal or not. Therefore, we must be very careful and should get at least one investigation, a biochemical investigation for these things, and at least one physical checkup to have the blood pressure checked.
So how
This
frequently these tests should be done?
Yes, the frequency, of course, I would come to, but I would even suggest beyond this to take a little time out one day and get a preliminary health checkup done, where an ECG might sometimes give a clue, one in a thousand chance, and ECG might predict a chance for a sudden cardiac death. There are
Okay.
certain kind of arrhythmias that can develop in pre-excitation syndromes that can be picked up on an ECG. And no doubt, if we can get an X ray and one echocardiogram done to look out for any structural heart disease, for example, hypertrophic cardiomyopathy, a lot of these people die suddenly,
Oh,
sudden cardiac
yeah,
death,
that's happening.
and mainly while exercising in the gym or anywhere else during any strenuous activity. Now, your next point regarding how often, well, if things are okay, I would suggest once in 2 years.
One
But
to
if
two
things are
is.
not okay, maybe more often. once in 4 to 6 months.
Is there anything related to age that after 30 one should do it regularly every year, or anything related to age also?
I would say the same, that if one set of investigations are normal, even once in 5 years, an echo or a echocardiogram or an ECG is enough. A blood investigation 2 or 3 times a year.
Okay, that's really important. Fine. So, Dr. Akhil, I want to understand that there's a lot of myths, these days, which I understand. So, coming to gym, people feel that, they're scared sometimes that if, going to gym also is not helping them. So, what do you want to say on that?
Um, yeah, that's a very valid question that you've raised. We've been hearing that people are dropping dead in gym, and that is why some of the youngsters are refraining from going to gymnasium and getting their exercises.
Because we are hearing the term that यार वो तो जिम जाता था और फिर भी ये हो गया तो मतलब there is something missing. What is that point?
Yes, that is what we are coming to. As Dr. Jhamb has rightly said, there are many other factors which are leading to this problem with the heart arrest, sudden heart arrest, which are unknown. People don't get them diagnosed. So going to gym has nothing to do with people dropping dead. So gym saves more lives than it takes. I mean, much more. So going to gym is a very healthy habit. Out of thousands, maybe lakhs, only one person will suffer an event like this. So just by looking at that one random event, we cannot generalize that going to gym will make you drop dead anytime. So that's an entire myth, and it should not be taken as a rule.
So
It's an
मतलब that's not associated like no.
it's an
There-
absolute exception, and going to gym will definitely improve your health and the health of your heart.
Perfect. That sounds good. Yeah. So the next question is like how much the hereditary problem affects the heart attack thing. So we like if the parents have this problem or so how much it's relevant.
Let me answer this question because
Yeah.
this is more related to medicine and
Right,
cardiology.
right.
Dr. Akhil is a surgeon. He
Okay.
knows how to cut the sternum open and
Oh
take
my
the
God.
heart out in his hand. But I do not do that.
Yeah.
I'm a physician first and a cardiologist next. So let me answer this. Now, you see, it's very important to know that besides diet, exercise, modifiable, and the non modifiable risk factors that we are aware of, by non-modifiable, I mean age and gender. We all know males are more prone to heart disease, and age, elderly age. Modifiable factors I just enumerated before: sugar, blood pressure, cholesterol, lipids, and smoking. These are all modifiable. I mean, if somebody has high cholesterol, he can take a medicine for it under the advice of a doctor. And if somebody is smoking, you should know that smoking is just a no. One has to totally abstain from it. Now, let's come to the hereditary risk factors. So, for hereditary risk factors, a lot of blood investigations can pick them up. For example, some people may have very high levels of triglyceride, the normal upper range of which is 150 milligram percent, but these people may have 1000 or 1200 because they had a gene in them causing hereditary familial hypertriglyceridemia or dyslipidemia, and thereby their triglycerides are always high, cholesterol is always abnormal, they have to always be on medication and they cannot avoid it. But only if somebody gets the blood test done, one would get to know about this. As a result, I would strongly suggest that for newer and newer gyms and such opening, sessions or events like this, one should advise the individual to at least get one baseline investigation done. Good for everybody to know that
Right.
whether one is prone to heart disease or not.
Right.
Second, as I just pointed out, an echocardiogram can sometimes pick up a structural heart disease, something that the individual may have been born with and was totally unaware of.
Okay. So
May
that is
have-
also a possibility.
May have a small hole in the heart,
Oh.
may have a hypertrophic cardiomyopathy.
But until unless there's some symptoms, one will not be able to know because
Very
in an
right.
early because
That is
in an
what
early
that's
age.
what the message is. We should not wait for the symptom.
Very
But sir,
right.
I'll sorry to interrupt you, but the thing is like 20, 25, 30, we are hearing cardiac arrest at that age also recently. So one is not aware that one has to go to for these kind of tests. So what is other parameters to see that we are fit or not, or we have to go to test, because that is not the age that we look forward that to conduct this test. So what do you suggest for these
Yeah,
people?
you're very right. One should have a symptom to be able to pick it up.
Yeah.
But it is not true that the symptom may always be there. There may be something wrong on chromosome 14 of the individual, and thereby some genetic abnormality on that chromosome would make him born with hypertrophic cardiomyopathy. And most people with hypertrophic cardiomyopathy remain without any symptom till their teens or even beyond. Only a routine echocardiogram can pick it up. And these are the people who suffer of a sudden cardiac death during any strenuous physical activity.
Okay.
So while gymming, if somebody remains within the limits and remains at about 75% of the targeted heart rate, where the target heart rate is 220 minus the age, things may remain totally all right. But at heart rates above this, approaching 85% of the target heart rate or even higher, an individual with hypertrophic cardiomyopathy may have a sudden cardiac death. And we may be running here and there, shelved here, but nothing can be done. These SCDs usually do not give time more than a couple of minutes to help them survive, which means only an artificial external defibrillator, AED, which by law all of us must have at all common places, including railway platforms and
So
airports.
can you just repeat? What did you say? What is required?
AED
What is that?
is an artificial external defibrillator. Ideally, I would suggest even in a gym, it should be hung one at one end of the wall.
How does it work?
Yeah, very simple. All of us should be trained for it. It's a very simple mechanical device, and there are two paddles with a hand holder for them. One has to just hold the two. On each of the two paddles, it is clearly written where does the paddle have to be put on the chest.
Okay.
So tear open his shirt or vest, put the two paddles on the chest at the appropriate places where
Right.
they should be.
Right.
A simple button, turn it on, it will charge itself, and with a little press of a button in less than a minute, discharge on the individual. Maybe the individual may come back to life.
That's
But it has
really
to be
nice to
done.
know, sir.
This is something that has to be done at the most, I would say, in 3 minutes.
Yeah, within five
Sir,
minutes.
but I think we should all aware people, because I think and every home also one should have,
That
Yeah,
might be a
this
little.
is one of the
That
things
might-
how we can aware the people about.
That
We
might.
need to educate the people through these
Yes,
programs.
sir, because I'm hearing for the first time. I have seen only the doctors using those equipments and reviving the patients back.
they are
but
available
never
at
heard
many
that we
public
can
places.
also help someone like
They're
that.
available at many public places, even in India.
But people don't know about it.
People don't
But
know. about it.
ideally, every individual who can take care of himself and does not have any kind of a handicap to be able to take care of another should know about it.
That's really nice message. I think that's really nice to know, because many time at home we don't know, and if you are delay, for a few minutes, then it can be a late thing. And if you know it, we can save a life.
Absolutely.
Similarly, an ECG can sometimes pick up what we call as PEP
Okay.
or PES,
Right.
pre-excitation syndrome. And just the raw ECG can tell that this individual may someday
Okay.
have a sudden cardiac death because of a very fast ventricular tachycardia, fibrillation, or any other rhythmic abnormality leading to a sudden cardiac event in less than 2 to 3 minutes. It is also possible the individual may be lucky and nothing may happen to him the entire lifespan.
Right. Right. Right.
And he may never actually go to a hospital for an analysis
Yeah.
and live his entire life with it. But it's only if we get some raw investigations done, we might be able to pick up these kind of
Yeah,
things
obviously,
and
investigation.
predict a little bit of the future of the individual.
Obviously, that's perfect. What other tests you recommend one should get done on
Do you have
to
any suggestion?
Sorry.
Would you suggest
what
any
are any
other
what
test?
other
What
tests?
I would say is that in general, the public should come to the hospital or to their nearest diagnostic centers to get a routine health checkup every year. Everybody should get it done after 15 to 20 years of age to know these hidden diseases that they are having in themselves. So after 20 years of age, I would suggest that every individual should go and get a routine health checkup every year, once every year. That would go a long way. We should not wait for a symptom to go to a hospital.
So, being a
That
cardiologist, I'll add one point there. While we often get the various liver and kidney profiles done in the blood tests, so also we get our blood sugars checked and the lipid levels checked. But various labs do what we call as an extended lipid profile, where they look for some other lipid values
okay,
which we
which
are
may
born with.
okay.
Apolipoproteins. So apolipoprotein A, B, LPA, lipoprotein little a. We are all born with this. Whatever value we are born with, the same value remains with us throughout our lifespan. There is no medicine to check these. There is no
But main lipid
medicine.
profile one
But
may
knowing those values
yes.
may keep the individual a little alert and a little more diet and exercise conscious.
So, sir, as per your experience, you are also find there's a increase in the number of heart surgeries and all as previous time and now. Do you also feel this? Because we are hearing in the news, but
Yeah.
you have the real data because more are there more patients coming for that?
Yes, they are, especially after COVID. And this is a very important question that you've raised. COVID has caused a lot of changes in the human body, which we are not really aware of. But one thing that has come to light is that most of the patients who suffered from COVID have a blood thickening effect, which is proven and which might be one of the precipitating factors for a heart attack. So this is very important. Patients who have had COVID should be aware of this, especially 2 to 3 years. We are not still the field is in ambiguity, but it is quite well established that their blood is thicker than normal and they are more
But why
prone.
that so?
The COVID virus has caused this.
Oh,
It although it goes away, but it leaves a print inside the body. So that residua leads to a thickening of the blood, which may cause heart attacks more than what it used to be. So those patients who've had COVID are more prone to heart attacks now, and they should be aware of it, and they should keep them well hydrated. Whenever they are exercising, whenever they are exhausted, they should keep themselves well hydrated with good amount of liquids every day. So that would go a long way in reducing these patients from getting a heart attack if they have suffered from COVID. That is one. Second thing is, which is very understated, is the amount of stress that is responsible
yes.
for these heart attacks. Nowadays, very young people are very much stressed and they're not doing anything about it. So stress gives rise to alcoholism, smoking and all that, plus lack of meditation. So you do exercise in the gym, but you don't meditate at all. So your mental health is not very good. So take that stress out, do some meditation every day. Say 20 minutes of meditation goes a long way. Just 20 minutes of meditation every day goes a long way in reducing the stress in the body and will help in reducing the heart events.
I think very nice tip and very much required.
Certainly, stress we all
Really,
know is
really very
actually
important
a
point.
very big risk
Yes.
factor, not only for heart disease, but in the later time for a higher blood pressure, for a higher sugar, altered lipids, and even oncologists will vow and they'll admit that it does lead to a greater chance for various malignancies and cancers. And more so because of the multitasking and with the advent of all the electronic gadgets that all of us use, maybe two or three at a single time, all of us are getting more and more prone
Right.
to stress and its side effects. And I'll add just one point there to COVID. as Dr. Akhil rightly pointed out, we all are aware that COVID left behind late COVID symptoms. So, late COVID were those which were existent and continued to exist in the individual after 2 or 3 months of disappearance of COVID in the individual. And that has caused higher blood pressure, a higher heart rate, a heart rate variability, a higher incidence of atherosclerosis, or a greater chance for the coronary arteries or arteries anywhere in the body for that matter
Even
to
stroke,
get
yeah.
blocked. And as he rightly pointed out, a higher viscosity of the blood, causing the blood circulation to slow down, and a thick blood with a slow flow in various arteries, causing a poor.
So how to get over this? As Dr. Akhil said, that blood has thickened. So how to overcome through home remedies are there? Like meditation, you said for stress, but anything for this blood thicken, something on that?
That is to keep yourself well hydrated.
Hydrate.
If you have a risk factor, like you are elderly, and then you can take aspirin also to keep the blood thin.
That's already recommended by a doctor, I think.
Yes, that's already recommended.
Yeah. But anything for the youngsters, fluids you're saying that
Yeah, keep
hydrated.
yourself well hydrated. That's most important.
No, yes, sir, you say something?
Their diet and exercise are very important factors. So exercise does reduce the stress also, but as he did say, that one has to take time out for mental health
Meditation.
beyond the physical health, and meditation and yoga also, I would say, would definitely go a long way in reducing stress and keeping the individual healthier.
Perfect. I think that's a really very important insights we have gathered from both of you. But at the end, I'd like to understand last few tips you want to give to maintain a healthy heart.
I'll say only one thing: be happy and remain healthy.
That's nice.
Yeah.
So,
I would say that get yourself regularly checked. Get your healthy. When you are healthy, get your self checked, and at a regular interval, say once every year or so. And don't go to the hospital only when you are sick. So get your healthy checkup done, and you should be fit.
that's really nice. I think we all know how to maintain, but I think listening to the cardiologist and the surgeon, we understand that it's really nice to maintain a healthy lifestyle, and it's not a one-day process. After COVID, we all realized that there's a lot of changes in our body. As the doctor said, that the blood has thickened, and there's a lot of stress is there. But I think we have to ease out. We have to give importance to our body. We don't want to reach to a level where they can be part of our community as a friend, but as a surgeon we like we should not be reach to them, and we should do better and live a healthy lifestyle and promote more and more people to make aware. As doctor said, AED, I think AET you said, that
AED,
everybody should get aware about that option, that everybody should know about how the therapy.
You see, while diet and exercise remain the most important modifiable risk factors, which while sitting in the gym or being around can be taken care, but we should know that there are things beyond.
Yes. So thank you, Dr. Akhil and Dr. Jhamb, for the insights, and it was really helpful. We have known a lot of things that we all didn't know, and we look forward for more sessions like this. So, Kami family, it's really nice to listen from them, and please take care of your health, meditate, and take ease at the. It's really important to take care of yourself. Thank you so much. Take care.
Stay fit, be happy, and vice versa.